Mark your calendars now. Mother's Day is this Sunday. And this week we're taking a closer look at the ways mothers and mother figures impact our lives and how motherhood has changed through time. Many people experience motherhood alongside a full-time career, and that means wearing many hats all at once. We're joined now by somebody who knows a thing or two about that, CBC health columnist Dr. Melissa Lem. Dr. Lem, thanks for joining us. You are, let's list them off. You're a mother, a family doctor, public speaker, add several more things to the list. Are there any particular challenges for women in the medical field once they become mothers?
Well, I would say that our experience as medical mothers is a lot like other new moms. No matter how much you've read or taken care of other babies and families, you don't know what it's like until you're back at home without a healthcare team supporting you, responsible for a brand new human. You know, we as doctors think we know what sleep deprivation is like because of the on-call we have to do as medical students and staff, but having a newborn takes it to a whole other level. And for many women who are career-driven and used to being in control, the motherhood experience can be a really humbling one. But I would say at the same time, every medical mother I've spoken with also says that it's one of the most rewarding experiences they've ever had. You gain a new appreciation for what mothers go through, and that ends up making you a better doctor.
When it comes to that, what supports do you wish you had more of, and where can they translate into mothers who may not be in the medical field?
Well, I would say a big question for a lot of doctors and other working moms, like you said, is how am I going to fit parenting into my life when you have to balance, say, training with paying off a six-figure debt, trying to establish your career, or taking care of your practice. And that said, there are definitely things that healthcare and other employers can do to make it easier, like providing childcare on site, or helping to cover childcare expenses, or allowing more flexible work hours, or even working from home sometimes. But you know what else is really important too is gender equity, is closing the gender wage gaps, which unfortunately also exist in medicine, especially in surgical specialties, so that women take home the same amount of pay for the same amount of work, and making it normal for fathers to take parental leave too.
Many working mothers, technically, they have two jobs. One they're paid for if they're in the medical field, and the one they do at home, which is unpaid. What impact does that have on a person's physical as well as their mental health?
Well, it has some pretty big impacts. And what you're referring to, Dan, is the double shift or the invisible labor that women have to do. Even though close to half of women in opposite sex marriages earn more than or the same as their husbands, the vast majority are doing more at home. A recent study from the US, in fact, showed that even in marriages where women are the top earner, on average, they're still spending 3.5 hours more per week on childcare and household chores. And on average, the only kind of relationship where women and men are doing equal housework is when the woman is the sole breadwinner. And of course, this can lead to less time for self-care, exercise, and sleep. We do know that working mothers experience higher rates of depression and anxiety than working fathers. So we need to actively change those social norms and put a higher value on that unpaid work to improve the health of working moms.
You've talked about the satisfaction you get from your career and serving patients. What's one of your favorite things about being a mom?
You know, Dan, aside from just how cute and funny my son still is at 9 years old, I would say that my favorite thing is how much purpose he gives my life. Almost everything I do in my work and my life, I'm thinking about how I can make sure that he has a happy and a healthy future to look forward to. You know, I would say that being a mother is probably the most important job I have.
CBC health columnist Dr. Melissa Lem, thank you for joining us today, and ahead of it, happy Mother's Day.
Thanks, Dan.